Hello, Dr. Braxton. Welcome back to the podcast. How are
Thank
you
you so
doing?
much. It's a joy to be back. I am doing well. Thank you. How are you?
I'm really good. I'm just flooded with memories. You and I go way back
Way back.
to
Yes.
graduation day,
Yes.
sitting in the same row, and I look down at you. You kind of like look up at me, like, "Are we
What,
done
right.
yet?"
It was a long day as I can remember. Yes. Yes. Wow.
Oh my
Wow.
goodness, we really have had such a lot of fun memories
Yeah.
along the way. When I decided to start a podcast, I remember calling you and sharing the idea. You were my hype girl no
Yes.
matter what I was ready to do. You were like,
You
you can
can.
do it. You should go for it. This is
Yes.
awesome. Yes, yes,
Yes.
yes.
Yes. Yes.
And you really, I shared with you this idea of the podcast, and you were like, okay, that sounds good. I'm on board. I said, okay. And then I needed all my friends to be like, yes. I said, so can I interview you for an
Yes.
episode? And you were still on board. So I
Interesting.
am I'm
Yes.
thrilled. Here we are recording. This is episode
I can't
339.
believe it.
And your first episode with me was episode number
Oh my goodness.
4.
In the infancy, when you're just getting started. Oh
That
my
is
God.
right.
Wow.
Oh my
Wow.
goodness.
That's a long time ago.
Yes. 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 You have been on the
Yes.
journey with
Yes.
me the entire time. I'm so excited to welcome
Thank
you
you.
back.
Thank
I have to throw in there as well that I'm not going to suggest anybody go back and dig. Although you could easily find episode 4. Those are back in the
Yes.
early days when I think I may have done my own
Yes.
editing at that point.
Yes, you did.
we, we were just
Wow.
rolling
Wow.
along. So,
No video.
but this is no, oh no, oh no video, no fancy
No,
microphone.
no, that at all. I couldn't see you. You couldn't see me. Just audio,
That's
like a
right.
phone call.
That's right. We I remember also I was trying to explain to my mother what I was doing. We would have business
Right.
meetings. I'd go over to her apartment on a Saturday and I'd give her updates about this business and what I was doing, and she, get all excited. She didn't understand the internet
Right.
at all. It was one big black hole to her. And the way I got her to understand what a podcast was I equated it to like the old
Right.
radio shows,
Right.
so she could kind of get an idea of what we're
Right.
doing. So I remember playing some of the episodes for her as they were coming out. I'd take my phone and I'd just press play and just, put it on speaker so she could hear. And she listened through, but she loved
Oh,
your
bless her
episode.
heart. Bless her
She
heart.
never, for- she never forgot. She would bring it up all the
Yeah.
time. And I mean, down to, my mother, I lost my mother to her battle. She lost her battle with
Yes.
pancreatic cancer. So I
Yes.
lost her last
Yes. Our
September.
condolences
But
to you.
she, all the way, every time you brought up the podcast, in fact, the few times like across the years when I would go to a conference and I saw
Yeah.
you and some of our
Yeah.
other classmates, and I would always say, yeah, you remember the lady from, the podcast, and you liked the episode so much about the church. And she's like, oh,
Oh, yeah. Yeah. That's
yay.
great.
I talked to her, I
Oh,
saw her. So I just want to make sure
I'm
you knew
glad.
that
Thank
because
you.
this
I'm
is,
glad it resonated with her somewhere. When we talk about the church, certain memories,
mhm.
stick with people. Even if they don't
Yes,
understand the entire thing, certain things kind of click. And I'm
that's
glad it
right.
clicked with her.
I also, Yeah, I also think that is an example of sort of the
Yes.
connection that we can have
Yes.
with the church,
Yes.
because once there's that understanding, it
Yes.
lasts.
Yes.
It's long
Yes.
lasting. So let's kind of give everyone an update, and for some people who are newer to the podcast, they will be getting to know you for the first time. But I still like to do the traditional style. Let's kind of go back a
Sure.
little bit and bring it up
Sure.
to here. So right now, just tell everyone a little bit about yourself, what you're doing now, and then we'll kind of start on the
Oh,
journey
okay,
part.
sure, sure. So I'm Dr. Juanita Braxton. I'm the executive director of Imani Consultants, PhD, which has a philanthropic arm called Sapphire Sisters. And what we do primarily is community health, education, and wellness. We partner with different organizations here in Northern California, primarily in the closer to Sacramento area, in the Bay Area as well. And we try to just share information bring factual information to faith based organizations. Those are many times the most vulnerable. They don't understand what's going on. And with so many different voices, sometimes, you trust someone that you know. And so we also give back in other ways. We work with veterans. We work with other local churches in their backpack drives. And, we try to hand out information. We try to stay current on what's happening in public health. And so, we still try to bring annual information to different churches, people that get annual checkups and dental, exams and eye exams, just really basic information. And then if there's some kind of crisis going on, when you think COVID-19, we try to bring factual information. We try to bring localized information, food deserts, nutrition. We try to cover the gamut. So it's been an exciting journey so far. My focus is still faith based organizations because I'm a part of them for the most part. Yeah.
Oh,
Hmm.
it's wonderful. Important work, and really glad to hear how you're touching on, these different
Yeah.
communities, which is
Yeah.
it's like that's our degree, that's our
Yeah. That
training,
is our
right? That's
training,
what our
right? Yeah. Community, community health. Yeah.
that's
That's
right.
us. That's us.
Well, let's go back to roll back a
Okay.
little bit and kind of share a little bit of your journey to this point. So, when did you first learn about public health or become interested in
Well,
public health?
it's interesting, enough, that it was at church. I was part of a usher ministry in the Bay Area. So for us, that's Oakland, San Francisco, and we have what we call like an association of different churches that come together to help the community as a whole, and then to go back to your own community. So we kind of met once a month. And I actually went to an association meeting in San Francisco, and I could remember it like it was yesterday. And I don't know how we got to talking about health and wellness, but it was an older African American member of our usher board was telling me, she's like, Sister Braxton, I went to a health fair in San Francisco. And she's like, I ride the bus. That's my primary means of transportation. And she wasn't a young woman. So she said, I ride the bus, and I looked out the window and I saw this huge health fair. And I thought, oh, I'm just going to get off here and go see what it was. Well, it was in San Francisco. They have a Chinese population, a huge, and they were putting on a health fair. And she got off the bus and she walked around, and she said they were giving you free high blood pressure checks, and they were talking to you about, foods to eat that would make you healthy, resources that they had. And I thought, wow, why don't we have that in our community? Why? She just happened to find that, but how many people could we reach if we actually had that? So it piqued my interest into public health because I had already had some advanced degrees. So I thought, in order to be a part of this, you kind of need to be at the decision making table. And so I decided then, I was like, I want to learn more about public health. And so I said, well, I'll just study for my doctorate in public health, because when you come into a lot of spaces, the more education and credentials you have, sometimes the more serious people take you. So that was really my first interest into it, was like, wow, why can't we, do these fairs to help our community that, they can come. We know plenty. I used to work at Highland Hospital in Oakland, where their departments were run by African Americans. So I worked for the chief of surgery, who was also a national officer. And I thought, we have the resources. We just need to pull them all together. So that was really my kind of first, hmm, maybe I can do something in this space of public health, to kind of affect not just one area. San Francisco can be Oakland, it can be globally. This can go from church to church to church, and we needed some information too. And I thought, how exciting that many other communities really take care of their family from birth till death, that they have resources, that they come and volunteer their time. And I thought, we should be able to do that as well. So it was really interesting that my first taste, so to speak, of public health was from the church.
I love that. I love that. And that's, essentially what you did quite a bit of, helping out in
Yeah,
your
yeah,
church. And Well, is there a particular population? I'm guessing, but I don't want to guess. Um, a particular
Mhm.
population or condition or say public health problem that you are most passionate about
Well,
now.
for me, still it's the faith based community because I think it's a missed opportunity that we have to share quality information that we can come in. The house of worship used to be just where people went to just pray and listen to the minister. But then, when you think about it, it's a captive audience. These people are going to be there for 2 hours. So it's not like you can't get in and get what you have to say. It teaches you also to be concise because, if you get a minister that will allow you to speak to their congregation, you only have a short window. No, they're not going to let you. The choir still has to sing. They still have to take the offering. They still have to preach, and so you get in and get out. But you're able to bring factual information, and I think that that's what's needed. I'm passionate about the faith-based community hearing factual information. We believe God can do
Mm,
anything. Yes, we do. We know God can heal. He can do whatever He needs to do. But He also puts people in place to bring us that information to tell us why you have, diabetes, why you have chronic heart disease. And I think that that's what's missing is that we hear a lot of rumors. In the Black church, we have a lot of home remedies. You put this on, and you grow it in your yard. So it's important that you bring factual information because there's a lot of myths, there's a lot of wives' tales, and I am
mhm.
really passionate that people have facts. You can do with it what you
Yeah.
will, but you need to have the facts.
Right.
Not that sister so and so called me, her brother, he got this, and we just put this on it. And I'm thinking, hmm, you, well, you probably can put that on it, but I would suggest you see a physician, get a medical diagnosis, that kind of thing. And so I think that's what really has driven me was that we were not getting correct information. It was not filtering down. You see it on the news, true enough, but you couldn't make it relevant to you. And so that's what we tried to do was try to bring it in a way that they understand, that we're able to touch many age groups at the same time. So in the church, you have children, you have young adults, you have seniors, you have men, you have women, you have gender fluid people. You have a lot of room to provide good factual information. And I'm passionate about
Yeah.
that part. Yeah.
You know, I completely agree with you. And when we had of course, our first
Yeah.
podcast episode was years before the
Right.
pandemic. We had our first episode was back in
Right.
2017. So episode 4 was back
Hmm.
then. So when the pandemic rolled around, I experienced firsthand what you're
Yeah.
talking about because my mother is very involved. Well, she was very involved with her
Right.
church and the elder
Hmm.
groups within
Right.
her
Right.
church. So we're talking about a relatively small Black church in the
Right.
community, and the pandemic was confusing
Oh,
all by
yes.
itself,
Absolutely.
confusing
Yeah.
enough. So with all the information that was being thrown around and interpretations being thrown around, it was very frustrating for I saw for the
Yeah.
elderly people, especially people like my mother who did not have internet
Right.
access. They didn't understand or it wasn't
Right.
participating. So even when it came down to getting the vaccine, you had to register online to get to the location. So there were all of these obstacles that whoever was making
Right.
the decision was not considering the fact that still have a group of people that aren't on the
Right.
internet and are having some issues. So I found myself choosing that lane
Right.
during that
Right.
time and really focusing in on the elderly members of my
Yeah.
family. That was really where I
Yeah.
focused in. I didn't get caught up. I did early on. I got caught up in a lot of
Yeah.
work that was coming my way with everything. But once I shut that
Right.
down, I focused on just because I wanted them to get the
Right.
information, like you're saying,
Right.
the
The
facts.
facts.
What they did with it was up
Right.
to them. But and I have my elderly family members. I mean, I'm in a blended
Yes.
family, so we've got red, some
Right.
blue,
Everything. Right.
all political aspects, and I bring up politics because that
It's
was a
huge
huge
part
part
of
of
COVID. Yes.
everyone's
Absolutely.
interpretation.
Yes.
So I found a way to just focus on exchanging the facts, explaining the facts, and then then they were making their decision based on
Right.
that, not other
Right.
interpretations of
Right.
misinformation. But and that was a
Very
challenge,
much
but
so.
that was where I stayed because of what
Yeah.
you're saying. That's a missed
Yeah.
opportunity. I think if we're not pouring in with
Yeah.
intention to this
Yeah,
particular
and it's
group.
really hard to break down because they watch the news, and so they see a lot of tragedy. And so, with me in particular, my husband's mother lives with us, and she's 93. And at the time, they didn't know, like, should I take this? Is this going to kill me? What is this going to do? And sometimes you just need to be able to allay their fears. You can work with them on a spiritual basis as well, but it was because the facts were not present, and the facts that were
Mhm.
present were not geared to them understanding. We can say all the coronavirus and all the big words, and they're looking like, okay, I know this means something, but if you can bring it to their level too, and I think that's what health education really should be, talking to the level of the folks that you're trying to reach. You have to know your audience, because if not, sure, you can research. As scholars, we know research papers and writing abstracts and all of that, but to an everyday person, that makes no sense to them. Makes no sense at
Yeah.
all. They're like, oh, this sounds important, but they don't really know.
Mhm.
So it is important that people hear information that affects their well being in the way that they can receive
Yeah.
it.
Well, you mentioned that you work. Well, I know that you recently
Yes,
retired,
yes,
so you're living. And I follow your social
yes,
media, and I see the fun stuff that you're
yes,
doing with your
yes,
time. So I love how you live that
yeah,
and enjoy that phase of your life
absolutely,
too.
absolutely.
And then you're also working with serving in your nonprofit
Yes,
organization. You mentioned that
yes.
earlier. Can you talk a little bit more about, because I know before we started recording, you mentioned an initiative that you all
Yes,
focused on
yes,
this
yes.
year. So tell us a little bit about how you're looking to, who you're intending to serve this year through your
So
organization.
my organization, Imani Consultants PhD, I mentioned that we have a philanthropic arm called the Sapphire Sisters. So that's me and a couple of other women that we have met. I belong to a Corvette club, and we were able to connect. Our birthdays were close together. And we were always, whenever I would do something that needed help, I would always call these women, and they would always come. I was like, I get you guys involved, and so many shenanigans, and they're like, no, we know this is important work, and so they would come and help me. So over the years, we realized that I live in a military community here in Fairfield, and veterans have a really hard time here. What do you do? We have a veterans clinic. We're close to other military hospitals and facilities, but it does something to you when you see a veteran on the street, when you can see a veteran experiencing a mental challenge. And I am also a veteran, so I go to the veteran hospital, and I go there and I see so many people that gave their life to this country, and they are struggling. And so our initiative this year is to work with the veteran population to see what we can do, see what resources that we can provide to them, see what information, see if we can gather information to share in our communities. It's hard to help everyone, but in all of the groups that I belong to, every one of them has veterans in it. My husband is a veteran, so he hang around with veterans. We drive cars with veterans, we go to church with veterans. So this is a population that we know that we can affect and help in some way, whether big or small. So our initiative this year is just to figure out how we can help. So interestingly enough, Dr. Huntley, I went to give blood at the military hospital on Friday. And as I was sitting, I had a shirt on that says Sisters in Service Loading. So the phlebotomist was a young black gentleman. He said, "What does your shirt mean?" And I go, "Well, we do community service, here and locally, here in Sacramento, here in Fairfield, wherever we can. And we like to partner with other groups." He said, "I've never done this, but can I give you my card?" And I was like, "Are you talking about a business card? Do you need a business card to phlebotomy?" He's like, "No." He said, "I run a nonprofit as well on the side for this. And we're putting together some fundraisers to help veterans. We service them here in the lab. And so if you would be interested in partnering with us." And I thought, wow. I said, look at God. Because how does, I mean, I'm just giving blood. I don't know these people from a can of paint. And so I thought, sure, we want to be a help in this community to do whatever. And he's like, there's such a need. And he's a veteran and he works right there in the military hospital. So I thought, what better resource to have than this young man?
Yeah.
So that's what we're going to try to do this year, whatever way that we can help. It may just be raising funds for them to get transportation to their medical appointments. People live in this area. We're kind of the central, so you can live 2 or 3 hours away, and we are literally the closest hospital to you. So if you have a doctor's appointment, you have to get here. And if you're,
Yeah.
in your 80s and you don't have children, you don't drive, you have to use Uber, you have to use Lyft. There's no transportation that may bring you here. And it's heartbreaking when you're in that space and you see people in need, but they don't know who to turn to. I saw a widow and she
Yeah.
came and they told her she had to come back. And I just overheard a conversation going, I can't come back. It took everything I could to get here today. I can't come back. I have to find a
Mhm.
ride and all of that. So we'll see how we can impact. And that's what we'll be taking donations and all of that to see if we can figure out maybe we pay their Lyft bill, maybe we pay their Uber driver, to bring them. So that's
Yeah.
what we're going to try to do in 2024 is help our veterans.
Oh, goodness, that really touches my heart. I hope that we can help you with this as well. I'm going to ask my listeners if you are interested in supporting the nonprofit with Dr. Braxton in serving the veterans. Then we're going to have the link in the show notes to your website where you can go, and once you get to the website, you can follow the prompts for making a donation and be able to support this cause. I think this actually is a perfect segue into the next question that I want to ask you, because I feel like it ties so closely together, such an example of public health in action. But I'm curious to know how the understanding of public health has helped you to serve your communities and have a greater impact.
Dr. Huntley, I think it's the knowledge of what public health is. And it's so broad and it encompasses so many different things. Just learning about what's in your local area, what the definition is. The definition is different to different people. And you have to, and it's a process. When you think public health, you think, oh, you can get a vaccination. It's not that simple. You have to find the location. You have to make sure that they have the personnel on staff to administer the vaccination. Then you need to read the information to make sure that it does not compromise whatever else you're doing. So, public health and the study of it gives you a comprehensive understanding that it's not just one thing. Everything we see, we're in the era of we want it now, we want it right now. And in public health, everything is a process, it's a thing. You can't, when you study disease, you realize, the people that have diabetes, you got to figure it out. How long have they had this? What can they tolerate? What medications can they take? Is this something that they need to administer themselves? Do they have to come back and forth to appointments? The study of public health lets you see top to bottom or bottom to top of everything that goes on. Disease is so complex. I think of epidemiology where you're kind of studying what's going on. It's so complex. And we get the end results many times in the community, right? We don't get the hard work that took to do the trials, to do the testing, to publish all the paperwork. Once you get into this, you realize there's 9 million pieces of paper to sign. There's all these precautions, there's all these challenges, but the public gets the end result. And so when you can see how to shorten the start to the end for someone, because we know it's not simple. There's trials, then they have to get participants, and there's surveys, and all of these things are important to the study of any particular disease. It helps you to have a better understanding of how to capsulize this information for the everyday person, because it's not so simple. You think at the end, oh, they're just telling us about, a COVID 19. There was a lot of studies, a lot of trial and error. They didn't
Yeah.
talk to every single person. Well, they didn't talk to me. Well, we can't talk to everyone. So we do a sample. You may fall within or outside of that sample. Nothing is concrete, everything is fluid in public health. Everything. And I think the
That
public
is,
doesn't really understand how challenging this can be. This field of study can be for anyone.
yeah, yeah. I think it's something, it's a continuous
Yes,
conversation.
all the time, all the
Yeah,
time. Yeah,
yeah.
yeah. So it helps to understand the total picture. And if one person has it, they can share it with 1,000 people.
I agree. Well, this has been so much fun to catch up. As we begin to wrap up, I'd like to give you a chance to share a tip with our audience. I mean, we've got such a mix of people listening to this
Mm-hmm.
podcast. Some are students, some are early career professionals, some are senior professionals, entrepreneurs, just a mixture. But just a general tip for someone
Mm-hmm.
listening from your considering your background, you've got such a
Mm-hmm.
rich experience in the work that you're doing now. For someone that may be interested in doing something
Yeah.
similar to what you're doing, what bit of advice do you have
You
to
know,
share?
my top advice that I think that I share with most people is just do it. Find something that you're passionate about. Earlier, I was telling you about a student in my congregation that I used to teach her Sunday school. And so I know that she had to find something that interested her. So I didn't know she was doing something in the public health space at all until she started sharing with me that her concern as a college student was food deserts, that students could not, eat. They were not, you can't only pay for tuition or you can have lunch. What are you going to do? And so my tip was her is just to write about something that you love, that you're passionate about in this space. And then you become the expert on that. So she went and studied. She got a mentor at the University of California, San Francisco. She walked around to different college campuses. She called. She did all of that, with the help of her research mentor. And she was able to publish her first paper in a peer reviewed journal, and she was so excited. You would have thought she won the Grammys, the Academy Award. She was so thrilled. And I think it came from her just do it mentality. Find something that you're concerned enough about, that you care enough about, that you want to help
Mhm.
change. When we went to get our doctor's degrees, it's all about social change. Be the change agent. You be the change that you want to see. And I think that's my tip is don't wait for people to come and bring you information. A lot of times the information is at our fingertips and we just need to do it. Just do it. Know your audience as well. Know what you're looking for and how you want to share it with other people. That's my tip is just do it. Just find something that you love in the public health space, something that you can commit to. Because we find a lot of little things and, we dabble here and there and we look up this and that and then we just move on. But if there's a space that you are really comfortable in, that you're like, I want to see this change. For me, it was faith based health education. For somebody else, it may be helping the elderly. It may be helping, young people. It may be adolescent hypertension. It may be, you know, caregiving. It could be any number of things that you want to. The public health space is so broad, as you have showcased to us in 330 plus episodes, how broad this is. The more people you get, I'm like, man, who's doing that? And there are people that
Yeah,
are doing everything under the sun, and everyone needs help,
yeah,
right? You can't do it
yeah,
alone. Go back and listen
yeah,
to 330 episodes and find your spot. Then pick it and just do it. Just do it.
yeah.
Just do it.
I love that. I love that. Well, we will have links for to connect with you in the show notes. But just for someone who's listening now and is curious, what's the best way for our listeners to
Well,
connect
there are
with you?
several ways that you can connect to me. You can go to Imani Consultants, PhD, at .org is our website, and you can read all the information on there. I also have a Facebook group. It's called Imani Consultants Health and Wellness, that we post different links and information on. there. I'm also on Instagram. You can look for me as Dr. Juanita Braxton, PhD, on there. And I partner on there with a lot of different public health people. So, you follow people that have the same interests. So you'll see, of course, I'm connected to Dr. Huntley, and then I'm connected to people she's connected to because they put out some good information. So we want to be able to follow people on social media that we know is doing the work and that are not just sharing stories of stuff they heard, but of things that they know. And so follow us on all of these social media platforms. You can just Google us and you'll see past episodes and different things that we have connected to. So, I'm all over Google. I'm everywhere and
That
nowhere
sounds great.
at the same time.
That sounds great. Well, thank you so much for making some time to come back on the podcast and share an update with our audience. It's a very proud moment
Yeah.
for me to have you back here from, like I said, those beginning days to, where we are now. So just if we keep this pattern, when we get to episode, what, 600
At
and
60 at least, I'll be back.
yeah.
I'll be back. Absolutely. For the next 300, I'm looking forward to being number, let's see what number I will be. I will be 669. So
There we
I'm
go.
looking forward.
There
It's
we
been a
go.
pleasure. It's good to look back, and I'm so proud of where you have stuck with this, and you have really showed us the work, the broad field of public health, and I think that's what helps us to share your podcast with other people is that you can go back. You don't have to do what Dr. Braxton is doing. There's plenty of work, public health.
Yeah.
Clearly, there's plenty of work.
Yeah,
Yeah, yeah.
that's true.
Get to it.
All right, Dr. Braxton, I'll be
All
in
right. Thank
touch.
you so much, Dr. Huntley. It's been my pleasure.